Good day, this is Steve from Physio for All. Today we're going to demonstrate a functional lunge test where we're going to get Katrina to, from the position she's standing in, to functionally lunge and bring her knee in to the bed. And what you can see is we're looking mainly at the range of motion through the ankle. Now I'll get Katrina just to show you how far we measure from the actual foot of the bed. So we look at about a 10 centimeter measurement, so we've got a tape measure out there, and we'll come across to about 10 centimeters. So the average we're looking for is about a 10 centimeter distance. So we'll get Katrina to redo the test now. So this is something that's really easy for you to do on your own at home. So put a piece of tape down and then functionally try and drop your knee in. The really important thing here is to make sure that your foot is firmly on the ground. So you don't want your foot coming off. So if you see Katrina's foot lifting off, that's cheating, or you know, you're really trying to compensate for stiffness or tightness through the Achilles heel or the ankle. You want the foot firmly and flat on the floor, and you want the knee as close to the bed as possible. So if we'll get Katrina to show you, if the knee doesn't go all the way, it's just short of that, then that could be suggestive of stiffness and tightness through that area, the ankle and the Achilles, which then can land up giving problems in other areas. I'll just show you from the back. What we don't want is Katrina cheating again and shifting her body weight around. You see how she's moving inwards or outwards. Again, that will skew the results. You can see her heel coming off. So you want her to be as flush and forward and keep her form, and no moving inward or outward. Generally people tend to collapse inward, so Katrina will show you to try and get that extra movement. The other thing you don't want is the back leg interfering. So in other words, when you do the test, don't put your left heel down, because that will affect what's happening on your right side. So Katrina will move her left leg away or just lift it off the ground while she's doing the test. Now this test is really good. You can do it on your own. If you're having knee pain or shin pain or foot pain or even hip or lower back or pelvic pain, this could be coming from a stiff ankle and stiff functional range into dorsiflexion, and it's something that you should be getting a professional to have a look at. So here at Physio for All, we would look at that as a functional test for anyone who comes in with lower limb pain. Again, if that anywhere from the hip, pelvis, lower back, knee, ankle and foot pain. And once we've actually identified this as being a problem, we would then treat for it. So it's again a very easy test to do on your own. Be careful you don't cheat when you're doing the test in terms of rotating inwards or outwards, okay, and make sure you get the measurement right. So we're looking at 10 centimeters away from wherever you're doing the test. Put a piece of tape down, and that works really well. This is Steve from Physio for All. Revitalize, bounce and be healthy.